Children's National is a rather unique organization here in the nation's capital. We serve as a primary referral center throughout the region, the nation, and internationally for a lot of different disorders, including cancer, critical care, neurology, neurosurgery, orthopedic surgery, and others. We currently have 3 intensive care units: the neonatal intensive care unit, the pediatric intensive care unit, and the cardiac ICU. We're very proud to be the recipient now for 3 years in a row for the prestigious Leapfrog Award for quality and safety. We also are very happy to be designated as of last year as a magnet organization for nursing excellence.
Our journey to the EMR began in earnest in 2001. We began to understand and recognize the value of the implementation of the EMR from a quality and safety perspective, but our vision and our strategic plan called for a full implementation, if you will, of an electronic health record over the course of the next several years following the CPOE implementation. And Cerner was the vendor of choice in terms of being able really to offer a complete solution. We used a phased implementation process. So our phase 1 was our CPOE implementation, which occurred in December of 2005. And our phase 2 implementation in May of 2007 was our implementation of the nursing and physician documentation solutions.
The life of a critical care nurse is a busy one, and to have some kind of technology put into place that reduces that workflow is really invaluable. The solutions that we put into place through the electronic health record have been wonderful for nursing, to be able to reduce the number of verbal orders and to have standardized physician orders that you don't have to worry about issues like legibility. For a nurse, that's really important.
Before we used to have to write on paper, but now we're able to just by the click of a button have our technology for our vital signs come in, and also to monitor our eyes and nose, which is very important for critically ill patients at the bedside. Before we used to calculate with a calculator or pens, and now we can just allow that information to be pulled in automatically. So all the fluid and medication, especially because our population is a very small population, it's very critical for their weight to monitor.
Physicians really derive a remarkable amount of value from the electronic health records. In the era of the electronic health record, we now can retrieve complete, reliable, and accurate information about the patient, allowing physicians and other providers to make very well-informed decisions, and that overall improves the quality of the care that's delivered to children. They also get decision support that's built right into their workflow to allow them to be smarter in providing the care to the patients that they so care for every day.
Well, I'm a neonatologist, so Cerner's solution allows me as a critical care doctor to acquire data very quickly, and you need accurate, timely data when you're taking care of a critical patient. So I can pull up at any computer in the hospital the patient's vital signs, how they're responding to their medications, their ventilator settings, how they've responded to orders that I've put in for ventilator changes. So it's key, especially in the critical care world, to be able to have that data accurately and timely. I think this technology it has already revolutionized healthcare. The ability to pull data and to analyze it and to look at quality improvement is greatly enhanced with these systems, and will really set the future on how we can improve healthcare for our patients. It's already done it, and I can't imagine what's going to happen in the next 10 years.